I'm going to be demonstrating the use of an oscillatory device. This is actually called the Boing, and the Boing is called Body Oscillation Integrates Neuromuscular Gain. It can also be used with a body blade, and Dr. Schulte did a study that shows that when you have an anterior glenohumeral joint dislocation or anterior instability, you can end up having some kinesthetic unawareness, and so you want to make sure that their awareness or your awareness can be inhibited. And so when you're not aware, then dysfunction follows. So using this device, you can increase that awareness and then and help the patient continue progressing through their rehab. So I'm going to have my patient standing. I actually have her kneeling for the purpose of the video. And she's going to keep her at lower than 45 degrees. So we're going to work on both flexion and extension. Then we're also going to work on abduction and adduction. And then we're also going to work on internal and external rotation. So we're going to start at a low range, and then as she progresses, we can increase the joint range of motion as well. So in the 45 degrees, we're going to start in flexion and extension, just oscillating up and down, and keeping the motion, keeping her body stable, and all of the motion is actually just coming from the shoulder. She's going to stay in this low range when she starts. And as she progresses, we can increase that range of motion, and she can slowly come up to about that 90-degree range, or also work through her entire range of motion. And then come on back down. We would do this at a 3-to-1 or 1-to-3 work ratio, whereas if I had her do it for a minute, then she would rest for 3. And we would do this several times until the patient is fatigued, and do this 2 to 3 times a week with at least a 24-hour rest period in between. And this would also be in the later stages of rehab. So I'm going to demonstrate here at abduction and adduction. She's going to start in the low range. Just stay there. She'd do that for about a minute and then rest. And as she progresses, work through that range of motion, progressing all the way through abduction and adduction. And then she would bend at the elbow with internal and external rotation. I'm videoing. So internal and external rotation. And then you can also progress through with PNF patterns. So with PNF pattern, they're functional motions, and a functional motion that would go from across the body and out and up.
Yep.
And then start from the outside and in.
Shaking.
And these oscillatory motions improve that kinesthetic awareness of the shoulder and can help a patient progress in their rehab.